Welcome to the HEARTS Entwined podcast. In this podcast, we'll be having discussions around the secrets which attract lasting, healthy, fulfilling relationships, creating a healthy mindset, and what women should know and understand about men. Introducing your host, Lyn Smith, the Queen of Hearts, relationship expert, trainer, speaker, and best-selling author of the Cupid's Bow technique. Lyn's mission is to have a positive impact in reducing divorce, domestic violence, and suicide.
Welcome to the HEARTS Entwined podcast. This is your host, Lyn Smith, the Queen of Hearts. And today, listeners, I've got a lovely guest. Her name is Alexia Harrigan, Dr. Lexi for short. Welcome, Dr. Lexi.
Thank you so much. I'm so glad to be here.
Now, today we're going to be talking about something really, really crucial in terms of women's health specifically, that I think is a very important topic. And for that reason, I think you're going to be an excellent guest that's going to be talking about something we've not actually covered before. Because Dr. Lexi, she is a powerhouse physical therapist, an educator, and the founder of Pelvis Power, PT, a concierge practice dedicated to helping women heal from pelvic pain, reclaim their bodies, and live with confidence. She's got 20 years of experience, and Dr. Lexi is on a mission to empower women and transform lives one pelvis at a time. I love that. So for this particular episode, I thought it'd be interesting to sort of have a running title around menopause and intimacy challenges, because this is all connected and related, isn't it?
Yes, it is. It definitely is.
So for you, what got you interested in this particular field to start with, Lexi?
Yeah, so I got into pelvic health physical therapy after having my son, after the birth of my son. He was 10 pounds, 1 ounce.
Wow.
Yeah. And I was in labor for 57 hours.
No wonder.
So as you can imagine, there were definitely some things that needed to get worked on afterward. And subsequently, I ended up having diastasis recti, which is basically when your abdominals are separated after birth and they don't have a hard time coming back together. And I had some bladder issues as well. I ended up having a surgery to help my abdominals because I ended up having a hernia. And so after my surgery, I went to pelvic floor physical therapy. And as a physical therapist, I didn't even know pelvic floor PT existed until that point. When I was in school years ago, that just wasn't a thing. We didn't talk about any of that stuff. We talked about everything else in the body. We got to the hips and we totally skipped that part. And so going through pelvic floor physical therapy myself, I was like, why aren't more people doing this? Why don't people know this is available? And so I took that on and I went back to school and got some additional specialization and training to treat pelvic floor. And it's been wonderful ever since.
Excellent. I love that, because I think a lot of women suffer in silence over this, don't they? They have a bit of guilt and shame. I mean, we have a little banter and laugh and a joke in the girls' changing rooms about it, but we don't really know how to address it in terms of knowing that it can actually be relieved or even cured.
Absolutely. It's kind of one of those mentalities of like, oh, well, you're a woman, you had babies, this is just your life now. But that's not the case. There's treatment for this. There are exercises and different things that can help. We don't have to live life with leakage. We don't have to live life with pelvic pain and the different things that go on. Just because we're women, that doesn't mean we can't get treatment and live our best lives.
Oh, I'm so glad to hear that, because I think for the vast majority of us, especially those that have gone through childbirth and like you say, we sort of accept that probably we're going to have a bit of bad bladder leakage and don't necessarily think that there's any alternatives other than having to wear pads for you incontinence or whatever.
Yeah, absolutely. Or some people think, surgery is the only option, but it's not. There is treatment for this, and there's pelvic floor physical therapy is probably one of the most conservative ways to treat it. And, most people don't even have to have surgery afterward.
That's brilliant. That's lovely news. So what is the advice that you give if you're talking to a woman and she's actually saying that this is an issue for us?
So what I would recommend is talk to your doctor, talk to your gynecologist, depending on the state you're in. If you're in the US, the country you're in, if you're not, talk to your doctor about your symptoms, talk to them about what's going on. I would probably go do a little research as well on what's going on with your body. If you're having bladder leaks or pain with intercourse, or if you have doming or coning at your abdominals after you've had your baby, kind of have that language to be able to bring that to your doctor, because not all doctors know or understand pelvic floor physical therapy. And so when you go to request it, you want to have a little bit of information and ammo to help you get those referrals.
Absolutely. And for me, what I've found is that I suppose in some ways I was quite lucky, because I did tear when I had my second child, which was my last child. And it sounds funny to say that I was quite lucky after a tear, but I was stitched up in such a really good, positive way by whoever sewed me up afterwards that, I was more or less back to normal pretty quick. Once that had healed, I didn't have any slackness or looseness in that area, and it didn't, affect my intimacy at all. But a lot of women do have problems, don't they, with intimacy afterwards?
Absolutely. Yeah, they do. And I mean, you were fortunate that, you had that really positive experience, but oftentimes there'll be scar tissue restrictions that happen. Sometimes they're stitched up too tightly. And that can be very painful, especially when returning to intimacy. Any kind of birth trauma can also introduce increased tension in the pelvic floor, so that can make it also painful. So there can be a lot of things that happen. And then also just delivering babies, right? Because we can end up with prolapses where our bladder kind of comes down, or our rectum comes down, or the uterus comes down. All of those things can happen where, you feel a bulge kind of at your vaginal opening. And those things can be treated.
Is it sort of normally a fairly straightforward, simple procedure to address those issues?
Absolutely. So typically when you go to pelvic floor physical therapy for those kinds of things, you'll be assessed by a physical therapist. And we really believe in a holistic approach, not just only looking at your pelvic floor, because everything is connected. Nothing in the body happens as a silo. And so we address not just your pelvic floor, but any muscle imbalances or weaknesses that might occur in your hips, your back, your core. Even the positioning of your feet can affect how your pelvic floor functions. So we like to take a look at all those things, including your breathing, so that we can make sure the system is working well. And oftentimes, even especially with women who have prolapses where their pelvic organ may be coming down, to a certain degree, there's different stages of them, but for stages 1, 2, and 3, because there's like 4 stages, but for stages 1, 2, and 3, they're very treatable and reversible with pelvic floor physical therapy.
That sounds so heartening to hear, because a lot of women, I'm sure, suffer in silence regarding these sorts of issues, and probably even experience a lot of discomfort when it comes to intimacy, not knowing that these can be addressed.
Absolutely. Absolutely. And a lot of women are embarrassed and fearful about just saying, hey, this is what's going on. And oftentimes silence can isolate us, and we can start feeling like, oh, I'm the only one that's ever experienced this. No one else understands. But then when we start talking about things, it's like, oh, you've had issues too, or somebody who knew somebody who had this. So you're not alone. And being able to address it, being open, even with your partner, especially like if you're having pain and discomfort with intercourse, it's important to communicate that with your partner so that they can, adjust appropriately.
Yeah, absolutely. Because sometimes I think we probably just think, oh, it's just down to childbirth, and it's just something we have to live with, rather than realizing actually, no, this might be something that isn't normal after childbirth that can be fixed.
Absolutely, absolutely. And I think it's the commonality that disguises itself as quote unquote normal, right? And just because it's common doesn't make it normal. And so after childbirth, and honestly, there are women who haven't had children that have pelvic floor pain and all kinds of other issues as well. So it's not just limited to that, but it is common, after having children.
So tell me a little bit about what you might be able to share as a possible, I suppose, simple type of exercise that you might be able to share with us on this episode now that a woman could try to alleviate any specific complication that we've talked about up to now.
Yeah, so I think that one thing that I would definitely encourage is I usually start with diaphragmatic breathing. And so breathing, and some people will call it like belly breathing, but it's really more of a 365-degree breathing and taking a nice deep breath, because when you inhale, your ribs expand, your primary breathing muscle, which is the diaphragm that's up underneath your ribs, that contracts and lowers. Then your organs lower and your pelvic floor lowers. And then when you exhale, the pelvic floor comes up, organs come up, diaphragm comes up, and air comes out. So it's a whole system that is impacted by your breathing. And oftentimes when we've either had children, right? So when you're pregnant, you can't do a lot of diaphragmatic breathing because you have a whole person occupying that space, right? So you end up breathing very shallow and in your chest. Likewise, after you have the baby, your body's already used to doing that motion. So oftentimes it doesn't go back to breathing the way you were. You do a lot of chest breathing, which limits your pelvic floor mobility. And if you're a person who's had pelvic floor weakness or bladder leaks, allowing yourself to and reteaching yourself to do that diaphragmatic breathing can help re-coordinate that pelvic floor function and also exercise those muscles. Additionally, if you've had pelvic floor pain, like pain with intimacy, pain with bowel movements, things like that, that same diaphragmatic breathing can help decrease tension in the pelvic floor, because your pelvic floor is hardwired to your nervous system. So that fight, flight, or freeze system is hardwired to that. And so is your breathing. So when you do a nice deep breath, you inhale, your ribs should expand, your belly should come out. And then when you exhale, your belly should come back in and your ribs kind of come down. So when you're used to chest breathing, oftentimes we're used to our chest kind of going up, and then our belly gets sucked in, but that creates a pressure difference that doesn't really help support our pelvic floor or its support. So I would say starting with diaphragmatic breathing would be the best way to address your pelvic floor issues.
So is it better to do that either solely through the nose or solely through the mouth, or one of each? How would you describe a good sequence to do it?
So I would recommend smelling the roses and blowing out the candles. So in through the nose and out through the lips. And as you inhale, you want to make sure that your belly is expanding, right? We don't want to inhale shallow where your chest is rising. Sometimes having some good feedback can help. So if you put one hand on your chest and one hand on your tummy, as you smell the roses and blow out the candles, you can kind of see which hand is moving more than the other. And then you can use that feedback from your hands to help take a deeper breath towards your belly.
Great, I love that. Smell the roses and blow out the candles. That's a great expression. And what about our posture? Is it better to stand up when doing this exercise, or sit down, or what?
So because breathing is functional and it's kind of essential to life, you can do it in any position. But sitting upright is helpful. You can do it in standing as well. You can even do it laying down. It really just depends on whatever position you're in at the time, but you can practice it while you're driving your car, washing dishes. You can just kind of integrate that, or even when you have some increased stress, you can practice that breathing so that you're decreasing the tension, not only in your body, but also in your pelvic floor.
Absolutely. I also think it's important to always, when we're doing any of these sorts of types of exercise, sort of think about what your posture might be, because obviously if we've got our shoulders rolled forward and our chin tucked in, that's not going to be a great position to start a breathing exercise, is it?
Correct.
If you sort of, back straight, shoulders back, and chin up.
No, you're absolutely right. You're absolutely right. And oftentimes when I teach postural exercise and postural awareness, I always say, like, imagine you have a string on the top of your head that is pulling your head up and away from your shoulders. So you're lengthening through your neck and your spine. When you do that, all of a sudden, everything starts getting in alignment. Your head becomes over your shoulders are over your hips, your core activates, and it's a much easier way to maintain upright posture when you're lengthening versus if you're trying to be like, too rigid with, pulling your shoulders back and things like that. So if you just pull your head up and away from your shoulders and lengthen, then it makes it a little bit easier to sustain.
Great. I love the way you describe that, because I think, some of these little details get missed. And if people don't do an exercise correctly, they might not feel the full benefit of actually doing it.
You're absolutely right. You're absolutely right.
So thank you for going into such detail around that. So in terms of menopause, then, how does that usually affect the way a woman's body functions in relation to any intimacy challenges they might have or bladder challenges?
Oh, it impacts it greatly. Our hormones play a really big part in the health of our pelvic floor and the tissues. When we enter into perimenopause and into menopause, because there's a whole phase, right? So the perimenopausal phase can last 10, 15 years, depending on
Wow.
when you start. Yeah,
So
and it's
this is the period of time before the actual menopause itself, isn't it?
correct, because menopause, you're considered to be in menopause when you have not had a period or a cycle for at least 12 consecutive months.
Right.
Up until that point, you're considered to be in perimenopause. And then once you haven't had a cycle for 12 consecutive months, then you will have hit menopause. And then moving forward, you would be like post-menopausal. But when those hormones, when the estrogen and progesterone decrease, as well as the testosterone as well, when those hormones decrease as well as fluctuate when you're in the perimenopausal phase and into menopause, the quality of the tissues. So if you think about like the inside of your mouth and how moist it is, how plump it is and squishy, it's kind of like your vaginal canal and your vaginal opening. It's plump, it's squishy, it's moist, all in there, right? But when hormones decrease, then those tissues get more fragile. They're not as plump, they're not as strong, they're not as springy. So then when you have intercourse, then it can kind of feel sometimes like you're having sex with sandpaper, right? It's just not comfortable because of the friction, because those tissues are thinner. And that can also generate pain with intimacy, with all that friction. So oftentimes people need to use more lubrication and things like that to help address that.
Wow. This is such a valuable conversation to have, because I'm sure there's many women that are going to be listening to this that resonate with a lot of what you spoke about and are probably suffering in silence,
Yeah,
thinking that there's
yeah.
not much they can do about it other than, just put up with it because you're a woman.
Exactly, exactly. I mean, even with the fluctuation of hormones, your sex drive, your libido can also decrease. And so that can make it challenging to engage in intimacy as well. Because if you're not in the space of like wanting to do it and having kind of that urge and things like that, generating the self lubrication that needs to happen when you have kind of that increased drive, that's important. But when we have less drive, then we have less lubrication. And that can also impact it as well, which is why communicating with your partner is really important, because you may need to do different positions, use more lubricant. You might need more foreplay so that you can make sure everything's all good and revved up before you jump into penetration. So all of those things are really important. And so communicating with your partner is key to making sure that you can have a good experience.
Absolutely. And I think quite often sometimes we're a bit reluctant to communicate, but I've found, with my partner, it's been, usually well received, if you communicate the
Absolutely.
situation, I don't know why we're sort of more able to share amongst our girlfriends than our actual partner
Yeah.
sometimes around these
Yeah.
issues, aren't we?
Yeah, absolutely. And when you know your partner and when you acknowledge that your partner cares deeply for you, right? Your partner doesn't want to hurt you. And so by being able to communicate, hey, these would be some things that could help me. These are some things that I like. These are some things that feel good, because we're really good at saying no and what we don't like,
Yeah.
right? We're armed and ready with all the things that we don't like, and not realizing that we haven't given our partner any tools on what we do like, because they'd be more ready to do the things we do like. But because we don't share those things, it makes it hard for them. It's like, okay, I don't want to hurt you, so I'm not going to touch you.
Yeah.
You know?
And they're not mind readers after all either, are they? So
exactly. So if we communicate, hey, this feels good, this works for me, I like this position, I like this speed or this pace, that helps them serve you well, and it serves them well as well. So it helps you guys come together. And when you've had pain, especially with intercourse, the body remembers. And so just like how we talked about the pelvic floor being hardwired to our emotions and that fight, flight, or freeze, that autonomic nervous system, that fight, flight, or freeze system, when you freak out, it freaks out. So if you anticipate pain, it's going to tighten up in response to that.
Yes.
So if you've had pain in intercourse before, it's going to be like, oh, I don't know, this hurts, this might hurt. And so it's going to take some diaphragmatic breathing to calm your nervous system down. You might have to take things a little slower so that you can relax and open and be ready for penetration.
That's such great advice. And I think, you're doing a fantastic job with helping women benefit on the back of your expertise and knowledge around all this stuff, because as we've said, there's a lot of women that are probably, massively suffering in silence over these issues. So I'm really glad I found somebody that's open to talking about this and has got the expertise and knowledge to share that gives people, women, hope for the future.
Absolutely. And, it's really an exciting time, because over the last 10 years, there's just been a lot more discussion about women's health and what's going on with our bodies. And we're becoming even more empowered to seek treatment and not just take our symptoms kind of swept under the rug. And it's a really exciting time, because we can definitely take more charge of our health and advocate for ourselves so that we get what we need, so we can have the life we want.
Excellent. Love it. So, Dr. Lexi, what's the best contact information that you can offer our audience members should they want to reach out and connect with you?
I would recommend them reach out and look for me at pelvispower.com. That is my all things pelvic floor website. And they'll be able to find information about me, as well as my upcoming menopause course as well.
Excellent. Love it. And also, any final words of wisdom around anybody that's listening to this podcast now and thinking, oh, I can really relate to some of the issues we've discussed. Any final words that you'd like to share around this topic of menopause and any intimacy challenges associated?
Yes. I would encourage anyone listening to take radical ownership of your health. You are the expert on you. Even as a healthcare provider, I'm great at what I do and I have lots of experience in what I do, but I can't tell you how it feels. Only you know that. And so in order for you to get the care you need, you have to speak up and you have to advocate and tell people what's going on, so that as healthcare providers, we can give you support. As your partner can help give you support and be able to help you move forward and address whatever issues that may be happening.
Excellent. Love it. Thank you so much, Dr. Lexi. I've really enjoyed this conversation. I've learned a lot myself, and I can relate to some of the issues definitely that you've addressed. So thank you so much for your time, and really appreciated your, as I say, words of wisdom.
Thank you so much. I'm just happy to be here.
So it just leaves me to say that true love starts with opening our hearts. And until next time, goodbye for now.
Thanks for listening to the Hearts Entwined podcast. You can follow Lyn via the Facebook group 2 Hearts Entwined, or search Lyn Smith inspirational speaker at LinkedIn or email lyn@hearts-entwined.com. That's LYN@hearts-entwined.com. Remember, true love starts with opening our hearts.